The primaries are over. We know who the two nominees are going to be, Clinton and Trump. And you have to ask yourself, you haven't heard a lot about this, but I think you're going to. What's going to happen with health insurance? Where is this going to fall in the discussion about what's going to go on with health insurance? Let me get you up to speed on a couple things I think you need to understand. Number one, Bernie Sanders is going to have a lot of influence on how the Democrat platform is put together. One of the key components of Mr. Sanders' campaign was a single-payer system. Let me explain for those of you who don't know what a single-payer system is. If a single-payer system is put in place, which was the end game of the Democrats when they put Obamacare through, but they couldn't get it all done in one fell swoop. But what a single-payer system is we eliminate all private health insurance, and all health insurance is run by the federal government. I'm going to repeat that. If a single-payer system is put in place, we will eliminate private health insurance. Your employer-sponsored health plan goes away. So your benefits you get from your employer are gone. If you have individual health insurance, it's gone. All of that goes away. The exchange goes away. Then we have one system, just like the Europeans, just like they do in France, just like they do in England, just like they do in Germany. We have one system that is for everyone, and that's the way it works. So the reason I'm bringing this up is I want people to be aware of this issue and understand. I'm not telling you which way you should vote or which system you should pick. I am telling you what's out there, okay? And I am going to explain to you what it means if you make the choice of voting for the candidate that wants a single-payer system. It means that private health insurance will be gone. So there'll be no more choices about deductibles, co-insurance, copay. All of that will go away, and you will have a government-run system. Some people may like that. You may want that. I would strongly suggest that you take a look at what you're asking for. As has been said in the past, be careful what you wish for. If you want an example of how a government-run healthcare system works, don't look at Medicare. That's a false, that's a red herring. That's not how this is going to work. Look at the VA. Look at the Veterans Administration system. Look at how that care is administered. Look at all the scandals with wait times for veterans, and you're listening to a veteran, by the way. I am a Vietnam veteran, and I hold a VA card. I don't use the services because I can afford private insurance, and I don't think it's something I should do and take somebody else's spot in line. But the system is pathetic, okay? The scandals over the VA system continue. The lack of accountability, people that have caused huge problems, veterans that have died, haven't lost their jobs. In some cases, they've been transferred to other parts of the country. The VA system is a disaster, all right? That's what a government-run healthcare system is going to look like. It's not going to look like Medicare, and when they say Medicare for all, that's false, and let me explain why, all right? Medicare right now is subsidized by private health insurance. What do I mean by that? I mean providers, hospitals, doctors, clinics, physicians, etc., are able to accept Medicare and Medicare reimbursement rates because of the difference that private health insurance makes in putting dollars in their pockets. If you doubt that, you ask any doctor or any hospital executive that question, and I guarantee you the answer you get will be that they could not run on Medicare alone. They could not run on Medicare alone. So when they say Medicare for all, understand what's going to happen. At the end of the day, when you get rid of all the health insurance companies, you're going to have a system that is a Medicare reimbursement system, which is significantly less than what they are reimbursed with private health insurance. Private health insurance makes up the difference in terms of reimbursement that they don't get from Medicare. So if this happens and it's Medicare for all, A, a whole bunch of hospitals and providers are going to go out of business. B, they're going to dictate exactly what you get and what you don't get. And if you don't understand that or you don't believe that, look at the VA system. Look at the Veterans Administration system and look at the problems there. Look at the prescription drug medications. Look at the wait times to get in to see doctors. Look at the procedures problems. Look at the veterans that have died because they had conditions they couldn't get treatment for. Now you have a mirror, or a petri dish, if you will, of what a government-run healthcare system is going to look like. Once again, I'm not telling you who to vote for. I'm telling you what to look for.